Soundbytes. Quick clips, long-term learning.
All right, this next case is a guy in his 40s who came in with worsening jaundice and abdominal distension. And it looks like they're doing a fast exam. So what do you see notable in the fast exam here, Rachel?
Yeah, so I see liver and kidney, and I'm seeing a lot of free fluid in the abdomen, and I'm also seeing like an irregular contour of the liver.
Right. Yep. So we see the kidney here at the beginning of the clip. And the liver has this kind of nodular appearance to it. This is consistent with cirrhosis as well. And you mentioned a lot of free fluid. So you think this patient has like a massive hemoperitoneum? No trauma in this case.
Yeah, I don't necessarily. Given if I know a little bit about the patient's history, I would probably suspect acidic fluid versus blood.
Yeah. It can be hard to tell though, sometimes on an ultrasound because they're both anechoic and you can't necessarily tell the difference between blood and ascites. But in the absence of trauma, this guy comes in and he says, I get paracentesis every week. This is likely more consistent with ascites, like you said. So now we'll move over to the left upper quadrant. What organs are we kind of focusing on there?
Yeah, so the spleen and the left kidney. And it looks like I see a little bit of perisplenic fluid.
Yep, there's a little bit around the spleen here. It can be challenging in the left upper quadrant, again, to get good pictures because of the rib shadowing. So you see a rib shadow here and a rib shadow here, right, that are kind of obscuring our view. But if we focus in this area here, we do see some anechoic fluid sort of just here anterior to the spleen, and a little bit around this portion. So that's just more intra-abdominal free fluid. Let's go down to the bladder now. It kind of looks like there's two bladders in this situation, right?
Yeah.
So it's kind of hard to tell just based on a couple of views which one is actually the bladder. I think it's probably the one that at this position here is probably the bladder, and then down here you see actually some probably bowel loops that are in ascites fluid that sort of looks like the bladder.
Okay.
But we know that's definitely abnormal. And then they're doing a longitudinal view of the same thing. We see two bladder-looking structures, which we know is not possible, so it's likely consistent with that continued free fluid. In this case, actually, the person was complaining of his hernia he has around his belly button was getting larger as well. So they put the probe on right over top of the hernia sac near his umbilicus, and what you're seeing here is that this stripe of the tissue is the abdominal wall and the peritoneal lining, and then you have herniation of this bowel contents and this ascites fluid into this hernia space. So this is just a umbilical hernia with ascites in it. See it again in another view. This right here is basically the lining of the abdominal wall and then bowel prolapsing out into that. So this was a non-strangulated hernia, was easily reducible, and he ended up getting discharged.
Okay.
Soundbytes. Quick clips, long-term learning. This soundbite is a shorter, digestible segment taken from our monthly Soundcheck podcast. For the full episode, check out the podcast on YouTube at youtube.com/MedStar Emergency Physicians or visit mepsono.com.